Okay, good. Welcome back to HIMSS. Mike Savilla here from Better Health, getbetterhealth.com. And our guest here is Earl Jones from GE Healthcare. Thank you for joining us today.
Very glad to be here. Appreciate it.
My first question is: I've been watching the Olympics and seeing all those nice GE commercials. Healthy Imagination, I think, is what it's called. What kind of prompted that? That seems like something that is very cool.
It is very cool, and I hope you enjoyed the commercials. I thought they were really fun, and they sort of hit the spectrum of emotions from being fun to being pretty poignant. I thought they were great. Let's talk a little bit about GE, and I'll talk about why healthy imagination is so important to us. So the General Electric company, we're a big company, but we are involved and committed into healthcare. I think everybody probably knows this from our healthcare technology business, GE Healthcare. But I think what people don't also always put into context is that GE spends about $2.5 to $3 billion a year as GE company on healthcare. I mean, we're committed, both as a technology provider and as somebody who's dealing with the rising costs of healthcare. So we launched this program about 5 years ago called EcoMagination. And EcoMagination was actually our company's effort to try to put sustainability into context. And we said, we're not just going to brand a sustainability initiative that's going to fall out of favor. We're actually going to do this in a way that we feel good about. We set out some objectives, which is we're going to put more money into research and development around environmentally sensitive friendly technologies. We're going to inform the public, and we're going to try to walk the talk, which is reduce our own greenhouse gas emissions. That eco-imagination turned out to be a wonderful rallying cry for our business. And something been very important to our customers and our employees. When it comes to healthcare, we're committed, as I mentioned. And we said, we need to be doing something very similar to rally the company and to rally the public around what is, certainly one of the most pressing needs today, which is getting our arms around healthcare quality, costs, and accessibility. So we launched Healthy Imagination last year. And it really is our corporate strategy around trying to improve the quality of healthcare outcomes, trying to improve the cost of delivered healthcare, and to increase accessibility for those who don't have it. And so it really is a broad-based strategy that impacts not just our healthcare technology business, but also our company as well. The ads that you saw during the Olympics, which again I think were just fun and really poignant, I think it's our largest marketing campaign in company history, but it's really to try to raise awareness, not just for the things that we're doing, but the importance that we as a healthcare ecosystem have to get our arms around healthcare. And so that's what Healthy Imagination is.
Oh, great, great. I'm a practicing family doc in Ohio, and I'm in a small group of docs. And obviously, one of the big buzzwords around here at HIMSS this week is meaningful use, and that's getting a lot of attention here. But what is GE Healthcare? How are they kind of dealing with that whole type of situation?
Yeah, so GE Healthcare is a global $18 billion healthcare business, and we do three things primarily. We have a healthcare technology business, diagnostic technology, so CTs, MRIs, ultrasound. We have a life science business, and then we have GE Healthcare IT. And GE Healthcare IT is about $1.5 billion healthcare IT business, and a lot of what Meaningful Use is focused on is healthcare IT. And at a time where it's very easy to be cynical and critical of government, I'll tell you, the High-Tech Act and the meaningful use criteria that's been put down from the Office of National Coordinator are really examples of very good government. So meaningful use says we can do better at using information technology to help our physicians and help patients live healthier lives when we get sick, to get well faster, and to improve quality, cost, and accessibility of healthcare. And so meaningful use is exactly what it says. Is there's a stimulus. It's $42 billion of stimulus that's being put out to doctor offices and hospitals to drive the upgrade and improvement of healthcare IT infrastructure in the U.S. It's phased over the next couple of years, which means we don't have to be meaningful users day one, but we need to build capability each year so that by 2014 we're actually going to have hopefully a nice step change in not just the infrastructure in healthcare, but also how we're using it to improve health outcomes.
Oh, great, great. And I know that you work with Health Information Exchange (HIEs). I'm starting to learn
That's
about
right.
that here too. How is GE Healthcare kind of working with that?
Yeah. So our business that I lead within G Healthcare IT is called eHealth, and the best way to understand eHealth is to put some of the problems in healthcare in context. And as a practicing physician, you live this. As a father of four, my wife lives this more than I do. But when we go to our primary care physician, it's hard to get information from a hospital, or if you're an emergency room doctor, which most ER doctors deal with this. An ER patient comes in and they have no medical context. They have no patient record. At best they can get is some information that the patient is able to provide. So what we can do is a better job of connecting the healthcare ecosystem so that we can share information, clinical information, so that our healthcare providers can just make better decisions. I mean, common sense here applies. When you get the right information in front of our trained medical professionals about our patients, they just make better decisions. And unfortunately, the state of healthcare IT today is about 15 years behind where the rest of the world is, or the rest of industries are, with healthcare, with IT adoption. In some respects, you could say the internet almost doesn't have a place in healthcare today. The good news is that's changing. And when we're able to share clinical information so that the right information is available to our healthcare providers about patients at the right time, we're going to be able to do some really transformational things. Not just on the health provider side, but we're going to be able to extend healthcare out we patients. I mean, I think everybody understands we patients are going to have to take more control of our healthcare and healthcare administration in the coming years. But today, we don't even have the tools to make good provider decisions, let alone which labs or specialty care facilities we should go to. I think empowering patients and empowering providers with better information is a cornerstone to transforming healthcare.
Oh, great, great. Dr. Yabal, you have a question for us, sir?
Yes. Are you about to make an announcement about a relationship with the Mayo Clinic? And could you tell us a little bit about that and your emphasis on quality measures and that sort of thing?
Yeah, absolutely. So today we'll be announcing that we've had a partnership with Intermountain Healthcare, and we'll be announcing that the Mayo Clinic will be coming on board as a full-time partner. There are a lot of great health systems, but I think Intermountain and Mayo certainly have global credibility in their ability to develop treatment protocols that just give superior outcomes. Um, there's two data points that I thought are really interesting in healthcare. One is that it may take the medical body of knowledge is doubling every 8 years. I mean, we're just learning so much more about ourselves as we type the genome. We learn so much more. The body of knowledge in healthcare is doubling every 8 years. But the surprising stat is it may take 10 to 17 years to propagate best practices and treatment protocols through the healthcare system, right? So doubling every 8 years takes 17 years to propagate. You can see how we get maybe generations behind in treatment understanding. We can do better. Okay, so what we've been doing is working with Intermountain Healthcare and now the Mayo Clinic to codify some of these best practices in software so that we can take these best practices and get them out into the market faster so that the best practices and treatment protocols don't take 17 years to propagate down to rural hospitals, for example. In concert with the announcement with Mayo Clinic, we're launching a product called Quilibria, which is a decision support engine that allows us to take best practice protocols like what the Intermountain and Health and Mayo provide and codify them in software so that we can actually give physicians in real time at the point of care the best clinical understanding of the diagnostic treatment that they're taking patients through.